The Trump administration briefly cut off federal grant funding for mental health and addiction programs across the country last week, only to restore that money within 24 hours. Megan Hartnett joins us in studio tonight. Megan, several organizations in the region were impacted by this.
Kaylee, it affects all communities. The executive director of the Lucas County Mental Health and Recovery Board says 4 local organizations received notices saying their funding was about to disappear. He says even though there was only a brief window of uncertainty, there were real consequences, not just for the people who rely on these programs, but for the staff who run them.
Everybody is scurrying to figure out what are the next steps.
4 organizations in Lucas County, including the Zeph Center and Mercy Health, were notified that roughly $2.3 million in grant funding they depend on was being cut last week. The letter said the defunded programs no longer aligned with the mission of the Substance Abuse and Mental Health Services Administration.
From prevention to medication-assisted treatment support, housing for homeless individuals, and residential substance use services.
Scott Silak, the executive director of the Lucas County Mental Health and Recovery Services Board, says this work relies on stability.
When we see this happen with no notice whatsoever, it takes an incredible toll, not just on the agencies that have to deal with this, but those line staff.
He says people using these services need to be able to trust that their care will continue and unexpected disruptions can derail progress.
You have to change the level of care that you have because we can no longer keep this open. Or, you have till the end of the week to find a new place to live. I mean, those are the real life decisions that were being contemplated in that 24-hour period.
Silak believes national advocacy efforts push the Department of Health and Human Services to rethink the decision and restore funding. He says he knows funding priorities can shift and contingency plans exist, but not with so little notice.
These things are essentially manufactured disasters.
Silak says the board is continuing to watch for any funding changes that may be coming. Silak says funding for mental health and addiction programs has been cyclical in the past, so they have had to work with less funds before. He says the key is having enough notice to realign resources. Reporting in studio, Megan Hartnett, WTOL 11.